Thank you very much. It's a pleasure being here. Small audience, but as I was told, it's the quality that really matters. And even if you only have one person that listens to your presentation, maybe that's the one that you really needed to listen to. So 2 years ago, at the FII, we signed an agreement with the Secretary General of the African Continental Free Trade Area, His Excellency Wamkele Mene, to empower people on the African continent to make better, safer choices. Across all industries, across all 55 African nations, or the 54 that are actually part of the AFCFTA. By the way, the world's largest free trade area by number of countries at the moment. One area that always bothered us is the pharmaceutical area. And before I dive into that, I'd like to highlight a few issues that that bother us on a daily basis. 3.5 billion people worldwide don't have adequate access to health care. 1.7 billion people are unbanked in the world, so no access to financial services, and this all comes together somewhere. Remittances today are estimated at about 700 billion. And that's the number that I focus the most on, and I've been focusing on it for the last 15 to 20 years of my career. Counterfeiting alone, not illicit trade, but counterfeiting alone of products costs the global economy $4 trillion every year. Now, you might not believe this, neither do I every now and then. That's a number from the ICC. If you ask the OECD, it's more about 1 trillion. If you ask the World Economic Forum, I think it's 1.5. That brings me to the conclusion we have no idea what we're talking about, because we live in a world of intelligent people, and if you cannot narrow down a multi-trillion-dollar problem down to plus minus 5 to 10%, there is something that is fundamentally wrong. If you look at Africa, which is our focus, this is a number up there that I struggle to understand. Because of counterfeit medicines, there are 630 million years of healthy life lost every year in Africa due to disease, and much of that due to counterfeit, substandard medical products. Remittances, before we were at 7, but remittances on the African continent are about 53 billion. You have again, and you'll understand later, 350 million unbanked adults. And again, in the corner here, the number that bothers me the most, in certain sub-Saharan West African countries, 70% of medicines in circulation are fake. Fake. Then you have substandard, then you have illicitly traded, then you have expired. So your chances of getting a legitimate medicine that might actually cure you is very, very low. And as I always say, for me, a dealer of counterfeit medicines is more dangerous than an arms dealer. Because when you go to an arms dealer, you know exactly what you're doing. You're buying a weapon intended at some point to probably kill somebody. When you go into a pharmacy, you intend to heal yourself, your loved ones, your close ones. But if we bring this all together, I'm trying to narrow this all down because we heard a lot of new science, technology, and everything today. I'd like to go back to one problem that we keep forgetting, which is the counterfeit medicines, the substandard medicines, the illicit trade of medicines, which cost human lives and economies a fantastic amount of money. We keep forgetting about that. And I used to say it's a problem we can solve tomorrow. And by tomorrow, I mean within months, if there is political will and if the companies play the game. So if you look at a scenario of what we came up as we continue our process with the AFCFTA, with the African Continental Free Trade Area, in empowering people through information to make better, safer choices, that process continues. Imagine a situation of a remittance. Money gets sent to Africa, or from here very often to Southeast Asia. Let's say $100. Scenario number 1, you send $100. Because you're unbanked, that's why we look at that, you're going to pay probably 10% fees to get the money there. So your $100 is $90 when they arrive. You tell your relatives, please buy the medicine that you need. It's one of the things I want you to do. They're not going to do that. They're going to go out, they're going to go drink, they're going to go have fun, and by the time they only have $10 left, they need to scratch their head, they're going to look for the medicine. Chances are they're going to get a fake one. So this is where this whole concept of the healthies comes in. In the other scenario, if you say, okay, I have $100 to send away, $20, do what you want with it. So you're still going to lose a few dollars there. It's only going to be 18 by the time they arrive there. But the other 80, I'm not just going to tell you, you need to send them on, you need to focus on a pharmaceutical product that I know you need. Could be for diabetes, could be health disease, could be HIV, could be tuberculosis, whatever it is. But I'll pre-program in all the attributes of that particular product. And that's easy. That can be easily done. I know which medicine you need. I know it from your doctor. I'll pre-program it into the currency. I'll also pre-program into the currency when you have to buy it. I'll give you 15 days, 30 days to buy it. And through the system, I'll make sure that you can only buy that medicine from an accredited pharmacy. My first trips to Africa many years ago, I was shocked by the number of pharmacies in certain countries. That explains how you get to 70% fakes, because probably 2/3 of them are not legitimate pharmacies. So you need to use technology. And I'm talking simple things compared to what we just heard here over the last 2 hours, and to map out these pharmacies. So you know what, when, where, who, and by whom. These are what we call our 5 Ws that we want to know, that we want to embed into the transaction. And if you as the recipient, you do everything right, you go to the right pharmacy, you get the right medicine, you verify the medicine. I'm not selling anything here to Sanofi, to Pfizer, to anybody else. When you verify it through the unique identifier that they already own, they already have on the medicine, we just need to use it. There is a 99% chance that, first of all, you can execute the contract, the pharmacist gets the money, you get the medicine, and it's legitimate within the time frame that was stipulated, and you're not getting an outdated medicine. If you decide not to do it because you're too busy doing other things in your life and not busy enough taking care of your health, the good thing is the money goes back to you. The contract cannot be executed. And you can decide, okay, I give you 1 more chance or 2 more chances or 3 more chances, but you're never going to get the money unless you use it for what it was intended for. And we're here today to look for support for that, because as our empowering people to do better choices on an industry-wide or industry-agnostic basis, we think that this is a real necessity. And it doesn't have to stop on products. It can be extended to services also. It's a little bit more complicated, but not much. It's just the product is very simple. It has a SKU, it has a unique identifier, has an expiration date, and it has somebody that is authorized to give it away. Now you can look at this problem, and I'll just bring up one more scenario that I could talk about this for, for days. One more scenario, if you look at not remittances, but donations. And I did, so I live in Abu Dhabi, but the company is in, which I co-founded, is in Switzerland. And we had quite a few discussions with the Global Fund, many of them informal. Now think about this whole scenario of how the money flows or shouldn't flow, or when it flows and why it flows. And if you look at the billions of dollars just from the Global Fund, but I think in total about 4 from the Global Fund, that flow every year to eradicate HIV, malaria, tuberculosis, and then other diseases that have been added, as well as vaccines during the COVID-19. There is, and everybody will have to acknowledge that, a very low to no level of accountability, auditability, and transparency. It's great that some people feel absolutely good when they know I'm responsible or co-responsible for sending 50 pallets of medicines to airport XYZ. We know some examples. And from then on, I'll move on and I'll do the same thing next year. Wouldn't it be better if I can understand where did my pallets end up? Was there enough capacity to actually distribute these medicines? Should we first build capacity before we send pallets full of medicines or money? If it's money, where was it used? When was it used? How was it used? Who got the contract? When did you get the contract? And so on and so forth. That's the beauty about this relatively simple technologies that we have called blockchain and stable coins, where you can actually program all of that. If the criteria is met, money flows in phases. If criteria is not met, that doesn't mean that a country is not going to get any more money. That needs you go back to the drawing table and you say, how can I ensure that the money that I'm sending to this country or to the continent is actually having the impact that we wish it would have? And how can I measure that? How can I increase my level of accountability, traceability, and auditability of every dollar that I spend by transforming it into a programmable monetary unit? And that is the fundamental of what we want to do and what we know needs to happen sooner or later. It doesn't mean that any of what we discussed here doesn't have the same high priority. It just means, and I had this discussion 2 years here too, when they asked me to talk about the metaverse, it's like, great, now we're going to talk about the digital realm and social commerce and all of that, but we're still not addressing this issue of counterfeiting and illicit trade. We're not addressing the issue of, I think I mentioned it before, 500,000 people dying in sub-Saharan Africa every year from fake medicines. I would put the number on the continent closer to 1 million to 2 million. We cannot allow this to happen. And focusing on beautiful new technologies is great. All I always ask, remember to have a sidetrack on the issues we have not resolved yet. Looking at the metaverse is fantastic. Looking at other ideas and robotics and AI is really great. But do not forget that you have a problem that remains the main source of funding of criminal, terrorist, and disruptive organizations. The platform that we have, I'm sorry my slides are not as fancy as the other ones, but the whole concept of Healthies is based on four pillars or ecosystems. The blockchain and stablecoin one. Not going to enter into the details. There were some interesting discussions about this yesterday, so I was pleased to see that fits actually completely the general thinking. AI, when I first did this, it was before AI became the hype that it is now. AI can be very simple. If you start looking at mass verification of products and incentivizing people to scan simply the barcode through an incentivized mechanism, the barcode of a medicine, that means you also have access to the e-leaflet. That also means you know how periodically that person takes that. And it doesn't take a lot of AI compared to the other things that I heard here to then start thinking, you're mixing wrong things. You're taking, let's not just talk about the life-critical medicines, but look at vitamins, look at supplements, look at how can interfere with the other, look at the absorption of the ingredients of a critical medicine can be influenced by something else that you're taking, and you don't even know that you might be canceling the effect of one by the other. 2 years ago, that wasn't this easy. Today, with AI, this is not a complicated task. The analytical ecosystem, for me, to crack the issue of counterfeiting and illicit trade, I'll say it again, I'll probably say it another 20 times, mass verification is required. You have to, this notion of we as pharmaceutical company 1 or pharmaceutical company 2, we have our own inspectors, we have our own people. You're looking at a continent of 1.2 billion people, if we focus just on Africa, 1.5 billion by the end of the decade, and apparently 2.4 to 2.5 by 2050, which could correspond to 40% of the world's population. So we need to help them address a critical issue that they have. But if you go towards mass verification, the analytical data that you can gather from hundreds of millions of people that add to that on a daily basis is absolutely unheard of. I got 1 minute to finish. And then the authentication system is something that, that we already have, that exists, that we have fully deployed. From a technical point of view, you're looking at the donors, the donor bank, the Healthies Bank, the minting, the creation of the smart contract, and the redemption of it. Anybody that is interested, please get in touch with us. A little bit about OriginAll in the few seconds that I have left. Margot, co-founder, Aham also a co-founder. Aham also happens to be one of the most successful fintech entrepreneurs in the region, in Dubai. Patrick McKee, similar to me, 10 years with the World Economic Forum, 3 years with the African Development Bank, and then just myself. On what we have, as I said, the agreement with the AFCFTA, the core technology which is fully functional, OriginAll that exists since 2020, but we have been working together. Actually, the 3 co-founders have been working together for 12 years now. And we have different companies for Interpol, for the World Customs Organization, that were very specific on that. But the first time that we have our own. We have an academic partnership focused more on the luxury side, ongoing discussions with governments and so on, and the Healthies, which is something that we would like to last. Time out. Just quickly, the platform, for those that want to look at it, it exists on the verification module. There are other modules that need to be creating. The other part that is very critical is our partnership with blockchain, with Partisia. These are people that are at the core of multi-party computation and zero trust technology. I don't think there is a better team. The cryptographers that are under Kurt Nielsen, they have been doing this for 20 years. So it's a very strong, very solid team. And since I'm out of time, thank you very much for those that attended. Thank you.